Hello students, Rajwinder here with the new topic that is belongs to nursing research, and this topic I particularly prepare for the students belongs to my previous college, and in this I would like to start the nursing research subject. And first of all I would like to discuss the introduction of nursing research. First of all, research is very mandatory for the profession. The profession is exist only when the research are there. And the introduction of the research is one of the few ways by which knowledge can be generated and a discipline can maintain its professional status and growth. Okay, nursing research is very important for the growth of the profession, and when we want to want to improvement in the clinical area, in the administration area, and in the education. For example, in the previous time we heard that our elder nurses check the temperature only with one thermometer. With one thermometer they check the temperature to all the patients, and after that researchers done, and the after analysis the findings are the researchers found that only one thermometer proliferate the microorganism in the patients, and because of, and after that patient suffering from the infection. And the solution, in the solution these days every patient has their own individual thermometer. Okay, and the infection rate comparatively low as compared to the past. Then next is methods of acquiring knowledge in nursing. There are two methods: unstructured method, which are traditionally applied, and the structured method, which are applied these days on scientific basis. The first one, unstructured method. Unstructured method have 5 kinds. First one is tradition, then authority, next one is intuition, then experience, then trial and error. We are going to discuss on the next slides. Then first one is tradition. Traditional nursing knowledge is learned mainly from with the help of books, journals, by words of mouth, and observing the practices of others. That is a tradition unstructured method. Okay, then the authority means in any profession, in every profession, only few people are experts in special knowledge, and they help to their juniors or help to the new generation for guide the new generation to improve the profession. And the authority, the people with higher length of experience in the discipline and with virtue of their position are believed to be a sound source of knowledge and understanding. Then the intuition. What is intuition? The things we feel, that is intuition. And the information obtained through sixth sense without conscious thinking, and there is no logic behind. But in this, the rationalizing the information may not be obtained. We can obtain the knowledge, obtain the information with the help of sixth sense, but there is no rational behind the intuition. Okay, the next is experience. Experience is a useful way of gaining knowledge, but relying solely on it and overhanging its importance can be detrimental to nursing practices. For example, in our hospitals there are experienced nurses there, more than 15 years, 30 years experience, but we do not totally rely on their experience or on their practices. Okay, then the next is trial and error. Trial and error is the most common approach of gaining the knowledge, but this knowledge often unrecorded and unacceptable in subsequent clinical situations. For example, one new nurse appointed in the ward, and she do not know how to lift the bed with the key, and after that she try and make mistake, trial, make mistake. After that she becomes successful. That is the trial and error, but there is no record of the trial and error situations, and it is not acceptable in clinical situations. Next is structured method. Till now we have covered the unstructured method. Here we have covered tradition, authority, intuition, experience, trial and error. Then the next one is structured method. Under structured method divided into four: logical reasoning, assembled information, problem solving, and scientific method. We are going to discuss in here logical reasoning. What is reasoning first? It is the mental processing of ideas to solve problems. Okay, when we use the mind, use the new ideas to sort out any issues, that is the reasoning. And there are two kinds of logical reasoning. First is inductive reasoning and second one is deductive reasoning. What comes under inductive reasoning? Inductive reasoning is, it is the process of developing generalization from specific observation. What is that? Generalization from specific observation. When we collect the data or when we observe one person, and on the behalf of that we think that everyone doing this behavior. For example, one nurse observed that one child very much anxious in the hospital, and she think that every child feel bad in separation anxiety. Okay, that is the specific observation. She observe only one child and she make the judgment for every child. Okay, then deductive reasoning, it is the process of developing specific prediction from general principles. For example, specific prediction from general principle. For example, in our fourth year there are 50 students and 49 students gave their exam and scored very high, but I do not know about the 50th students. But I thought that if 49s are brilliant in this subject, then the one left and the 50th number also brilliant one. Okay, when 50 students doing one activity in a brilliant manner, then the 10 or 20 left students also doing well. Then next is assembled information. Assembled information actually when we collect the data for future use. For example, it might be collected at the level of local level, national level, international level. For example, in our city there are various hospitals, and if we collect the data, how many women gave birth to the baby with the help of cesarean section or with the help of NVD, give the birth through NVD or through cesarean section. But that data may be we can use in clinical decision. Okay, assembled data in making clinical decision. Healthcare professionals also rely on information that has been assembled for variety of purposes. Then the next one is problem solving. Problem solving, when we use an idea to solve any kind of problem, and if that idea is very effective, then every time we can use that particular idea on the similar situation. Okay, nurses encounter means face several problems in their day-to-day life. When they use problem solving process to solve a particular problem and find a particular intervention effective. Then scientific methods. Research conducted within a disciplined format is the most sophisticated method of acquiring knowledge that human has developed. Human can develop their knowledge with the help of research in a particular discipline. Here the meaning of discipline is related to profession, because there are lots of profession, and every profession known as profession when the research exists there. Okay, research is most accurate, reliable and valid method of knowledge acquisition. Mind it. I hope this lecture is helpful for you. If you feel any kind of difficulty, I feel very happy to help you. Thank you very much. Take care.